So our work is focusing on how we can put children and young people's voices at the urgent work of reimagining. We start from a set of values that centres their rights to be heard and the importance of creativity and creative approaches in this process of listening and thinking together. We were very aware as a consortium that younger children's voices almost never get involved in these discussions, and we wanted to really challenge that. We wanted to think how to listen to their incredible wisdom about their lives and what matters to them, and also celebrate their amazing creative powers.
So we created a playful and supportive space for imaginative and therapeutic working. We discussed what it meant to feel well in our minds as well as our bodies, didn't we? And then we invited the children to draw maps of what matters to them and to reimagine prescriptions for well-being. Bethany, you told me that you created a map of importantness, didn't you?
I remember I included a duck pond and a river near me, which had fishes and quite a lot of small forest areas around where I used to live. I had the library and Wombats, which is a child sitting area near the library. It felt like I could show what I was thinking rather than have to put it in words, so it was clearer to describe.
Ruth and I then analysed all of this work from 1,000 children to identify the main themes that emerged and created the montages, some of which, as you said, you can see over there. Bethany, why do you think it's important for grown-ups who are making decisions about children to listen to children?
I think it's important that children have a say in things as well, because even though we don't get to vote, we still deserve to be heard as we are still members of the community.
So what we found, not only through this project, but through our wider neighbourhood working in East Cambridgeshire, is that what children, young people, families and adults often identify as needing to thrive are not necessarily the structures or services that we keep building and funding. Creative health is an approach which can help us to move from a focus on treatment to a focus on prevention, as well as being an inclusive approach for hearing from what matters from seldom heard voices. So hopefully our project reinforces the need for further investment. We wanted the children's voices to help shape the redesign of neighbourhood health in both East Cambridgeshire, the neighbourhood we're from, but also across the broader Cambridgeshire and Peterborough area.